The healthcare industry currently represents almost 20% of the U.S. GDP, and this will continue to grow. There are trillions of dollars spent annually, and there are many types of organizations considered as parts of the healthcare industry. For example, not only hospitals, but also clinics, medical group practices, individual practice associations, even individual practitioners or doctors, and ambulatory care organizations, as well as long-term care facilities, continuing care retirement communities or CCRCs, health maintenance organizations and other prepaid healthcare plans, home health care agencies, nursing homes that provide skilled, intermediate, and a less intensive level of health care, drug and alcohol rehab centers and rehabilitation facilities, and integrated systems that include one or more of these types of entities. So as you can imagine, we have a complex group of organizations, and these can be organized as either private, public, or not-for-profit entities. So if they are private for-profit, then they're investor-owned. If they are not-for-profit, they're still business-oriented, but they could be sponsored by some type of organization, for example, a community or a religious organization or a not-for-profit university. And then there are the public ones, the ones that are overseen, administered, part of the federal government, a state government, a county, a city, or possibly even a public university. So depending on the type of how it is organized, then it's going to be using either FASB or GASB. Right? So for the non-governmental not-for-profits, we will be using FASB. The private for-profit, we will also be using FASB. So as we had seen earlier in the semester, entities are either going to fall under FASB or GASB. All right, so if it's non-governmental, not-for-profit, or a for-profit entity, it's FASB. If it's governmental, then it's GASB. All right, so governmental hospitals and healthcare providers, these are designated as special purpose governments, and they are legally separate entities, and they're either going to be considered as a component of a government or they will be a standalone entity. So depending on how it needs to be disclosed in the financial statements, etc., regarding the relationships between the government and the entity would determine that. With our accounting for healthcare organizations, there are a couple of major groups, if you will, that have a lot of input and guidance, etc., for how things need to be handled. So I'm sure these groups work together with FASB in regards to the specific issues that come up, as well as with GASB in regards to the special issues that come up with accounting for the healthcare organizations. So you've got the AHA, the American Hospital Association, and then you've got HFMA, Healthcare Financial Management Association. So all of these organizations should be working together to, of course, help evolve how the accounting is to be done for our healthcare organizations. Think about how complex this can be. We will see how complicated these organizations are basically getting their revenues by charging patients or third parties for the services. And so you've got patients involved, but then you have insurance carriers, you have Medicare and Medicaid, and then you may even have grants and other contributions coming in because healthcare in many respects has a lot of charitable cases that get taken care of because of the lack of ability to pay. So all of this, in addition to legislation and regulation, makes it all very complex.